very much for joining us.
Thank you, Alexis, and thank you everybody for joining us today. My name is Marysel Pagán Santana. I'm the doctor in public health and have a career working with high-risk workers in vulnerable populations and rural areas like farm workers in Puerto Rico, and joined MCN in 2018 after Hurricane Maria passed Puerto Rico, and been working on hurricane preparedness and emergency management since then, hoping to improve and support capacity building activities when it comes to helping communities to withstand those events. So we're going to go over some of the best practices and knowledge that we have gathered in these years when it comes to working with health centers and how they can work with clinicians and communities to improve our preparedness, response, and recovery to hurricanes, especially now that we're about to begin the season. Migrant Clinicians Network, like National Farmworker um, um, organization, is a nonprofit organization. We work with clinicians and health centers to improve um, their knowledge, efforts, and capacity to address health in migrant populations with a special focus on agricultural workers and migrant farm workers. Today, we will learn a little bit of how hurricanes represent a weather emergency. When we look at the hurricane not only as the event that happens, but also the before and after of those events, especially when it comes to changing weather patterns and how we have been experiencing high intensity hurricanes and what that means for communities that haven't yet recovered fully from recent hurricanes. Um, we want to look at the impact of hurricane emergencies on migrant seasonal agricultural workers and employers. And we're going to share some examples about prevention and mitigation actions that we can, as clinicians, do in health centers. Also, some of these best practices can be applicable to community-based organizations and other organizations that are not exactly health centers, but work with health um, centers or clinics. So just if you're part of those organizations, you don't have to go. You can stay with us and look at it, because some of those best practice can be also be implemented by community-based organizations. Um, we would like to recognize how those hurricanes represent a weather emergency in terms of the impact that it has on health of communities, and also the impact that those communities and the fact that those hurricanes will have or can have in health centers. So we want to make sure that if we have an understanding that when we don't work with communities to prepare, there's also an impact that might be indirect to health centers when it comes to surge on ER visits, the instability of continuity of care, and some of those indicators that we track to take a look at how well are we doing with our diabetes management or hypertension. So there's an impact of those if our communities are not well prepared and are not able to manage their health when it comes to hurricanes. So we want to make sure that we look at hurricanes not only as an event that happens in the community and what we know is a direct impact, but also how our clinics might be impacted and how we can support each other to make sure that we are able to deliver the care that we want to, and that we keep our community healthy throughout the process of recovery. Let's see. Transition is a little bit slow. Oh, we're good. Um, this is the framework that we use at MCNs where we do assessment of weather emergencies and their impacts. We want to make sure that we understand that the emergency itself is not our biggest issue. It's actually the systems and regulations and public policy around that event that create the outcomes that we don't want to see. So we can have string heat, but if we have good laws and regulations, a comprehensive emergency management to heat waves, um, access to healthcare, infrastructure that's sustainable, we are unlikely to see outcomes like displacement, mental health issues, illness, injuries, and death. So when we look at it, we want to focus on the systems. We want to focus on how to improve those systems around our communities to make sure that the outcomes are less impactful, are less, we see less deaths, we see less injuries or illness. We're not saying that they're not going to happen. With a lot of the surplus that we see in some of these events are really caused by systems and the infrastructure rather than the event itself. And for example, I always use this data because it's really uh, something that we carry us, and I know Alex is going to be able to reflect on it. When we had Hurricane Maria on 2017, 80% of the deaths related to Hurricane Maria were after the fact, were not direct deaths, and were related to people with chronic diseases that were not able to sustain their care. So let's that sink in for a moment. We're talking about that we had around 4,000 deaths, and 80% of those deaths were preventable if we had a good system and infrastructure to continue the care of people with diabetes, asthma, and hypertension. So same happens when we look at some of the hurricanes that have impacted Florida. Some of the deaths were for people who had some disabilities or were not able to move, patients that were at home and were not able to be redirected to a care facility or a shelter that had the appropriate care infrastructure to those patients. So when we look at it, it's about systems, it's about preparedness and as a whole, and it's about our communication with communities to know what we need to prepare for. And again, this is something that we're gonna keep seeing. It's not there's a lot that is out of our control in terms of the how the patterns of weather are gonna keep changing for us. So we know that there's a hurricane season. We also know that we have seen more intense hurricanes. We also know that there's sometimes less time to prepare. We have seen that hurricanes are intensifying in 24 hours, 48 hours rather than 1 week. Um, so one of the pieces that we want to make sure that we communicate patients is that as soon as hurricane season start, and same with migrant farm workers, agricultural workers, as soon as that hurricane season start, or maybe the month before, we're talking about it, we're in May, this is Hurricane Preparedness Month, we should get our plans together. We should get our stuff ready to go because there's not going to be a long time for us to prepare when it comes to um, looking at it and see that development of the system and making sure that if we know it's going to get here or not. So we want to make sure that people know where the shelters are, how to evacuate if they need to evacuate, and how to care for their health when it comes to it before and after. Some of the challenge of agricultural industry is that this industry, because of the nature of the industry, is highly impacted when it comes to a direct impact of a hurricane. We see crop damage, the immediate loss of some of the production, soil eruption, infrastructure, especially with farm worker camps. There's a supply chain interruption, which means that you might be able to save your products, but you're not able to get them out of the farm. There's interruption in workforce, sometimes because they're not able to get to work or are unable to, or because they need to, they're displaced to another place, so they're no longer in the region. And there's also the piece of this is not something that you can just like rebuild in 1 week and make sure that your production keeps going. You have a crop calendar. Some of their areas that are less tropical actually need a whole year to revamp and to make sure that they are running again. So it's highly vulnerable to these events, which create another other type of issues in terms of like job security, um, the stress and mental health and well-being of the workers as do some employers as well. And sometimes because the vulnerability on the industry, we see a little bit of high risk conduct in terms of staying too late in the farms or getting in too early because we want to be able to save the crop because it will save our jobs. But also we stand in danger inherent to the ongoing emergency. So there's some dedicated areas that we have to work with employers and workers to make sure that we understand that there's challenges inherent to the industry, but we also want to maintain and save lives. So we want to keep people healthy. We want to save lives. We don't want people getting out too late out of the farms into their houses to prepare, but we don't want them rejoining the space too early that we're still seeing some flooding or some winds and they're in danger. As I mentioned, some of the recent events that we have seen that are impacting directly or that impacted directly the agriculture industry and their workers. Hurricane Maria, 80% of the crop in Puerto Rico was lost, as it was in Virgin Islands. And there's a really good study out of the farmers. 69% of the farmers experienced at least 1 month of food insecurity in the aftermath, which means that none of the products were moving even though they had the product that they were not able to sell. So they were not able to get food in their table other than the one that already having crops. So the same with farm workers. We're seeing that some food insecurity, although they work in the food industry, is really high when it comes to the after math of a disaster like a hurricane. Hurricane Ian affected really impacted the citrus production in Florida. It was already impacted by Irma. It was in the way of recovery. And then not only Hurricane Ian was kind of um, really a pushback to it, they saw some of the decline related to high temperatures as well. So the citrus production in Florida is highly vulnerable to intense events, intense weather events, and hurricanes are part of it as well. Sorry. And just to give you an idea, this is a map that was created by NOAA. And just to see, if you see in the left, in your right corner, south, you see all the hurricanes that have been passing by. And are just billion-dollar events. This is not all the events that happened, but what it means is that basically all the hurricanes that passed in the last years have created at least um, $1 billion losses. And we also have some intense severe weather happening that are not hurricanes, but also created some flooding that, again, if you're seeing this and you're looking at it, it doesn't have to be a hurricane. If it has an impact related or similar to a hurricane like flooding, some of the practices and mitigation processes are the same. So you can use them. And this is something that we saw also last year in Puerto Rico, even though we didn't have a direct impact for a high intensity hurricane in Puerto Rico, we did have flooding out of intense weather events that were related to hurricane-like systems that were not fully developed. So awards of rain, and you see Texas there with a couple of severe weather storms that caused a lot of dollars in damage, and most of them are related to crop losses. Hurricane Helene had a really big impact in the pecan farms in Georgia, and it says that it will reach around $10 billion in loss. And the reason why we're bringing the money amount to this conversation is because this is what guides some of the preparedness process and some of the push to keep working and saving some of the farms while we're in a disaster. And we want to make sure that even though we recognize those challenges, we make sure that the workers are healthy and are safe. And we want to communicate that to employers as we do preparedness and recovery process. People who are likely to be more impacted by weather events, including hurricanes, are people who work outside. You have agricultural workers, but also construction workers, landscape workers, utility and infrastructure maintenance workers, people who have low income, people who depend on medicine to manage their chronic illness, people who are pregnant, elderly, children, and mobile or are people who are migrating from one place to another. Uh, those individuals had a set of vulnerabilities attached um, to their own that bring an additional, let's say, challenge to keeping them healthy. And we want to work with the people who work outside. We're going to focus on that, but just remember that again, some of the pieces that we're going to be sharing with you can be adapted and work with other populations. So just make sure that you take what it fits fit to the community that you're working with. Conditions that are going to be affected. Again, we talk about the Puerto Rico experience with diabetes, heart disease, and some of the chronic respiratory conditions that we have, but also mental health disorders. And this is really important. We're upcoming hurricane season. We're going to see people who have PTSD or have adverse experiences with hurricanes that get anxious every time that there's a new system developing, that they're announcing that they might hit your area, and see if that person had a bad experience with the last one, especially people who migrated out of Puerto Rico to Florida or migrated out of Louisiana after Katrina to other states, people who moved because of disaster are now in places that might be vulnerable. We also have workers who were working in farms that are now working in construction in the process of recovery after Hurricane Ian and Hurricane Helene, and now they're in a high risk area to experience those hurricanes as we come to the hurricane season. So mental health and well-being is a piece that we really have to keep our tabs on and work with the communities to manage those processes and understand that there's going to be some um, feelings of loss and reliving those experiences and make sure that we don't get in the way of preparing for the next one. So what about the health of the migrant seasonal agricultural workers? So because they work outside and because of some of the pieces that I laid out in terms of the at risk of the industry, you'll see them working throughout the emergencies, including flooding. Um, they're often working in areas in danger. You can see this also when we talk about wildfires. We see farm workers working even though the air quality is not the best. Also, when we're back, there's a couple of the way that the climate behaves is that it's highly likely that the temperature and the humidity is going to be high. So the risk of the rotation or being exposed to heat is higher. And we usually we see them right away going back and trying to clean up and make sure that the crops, whatever's left or whatever survived, um, keeps being worked on. Also, pesticide exposure, mostly because there's some areas where the if the pesticide storage area gets impacted, there's going to be some exposure to that as well. Some of the additional challenges is the difference in language, traditions, and customs. Language is a big deal when we talk about preparedness. I'm sorry, preparedness, especially if the information regarding shelters, evacuation, um, lines of support or emergency lines is in English or not in the language that they are used to or basically dominate on the first language. We also seen some issues with the language of the recovery or aids that gets promoted out there for those communities or for people working on the farms or farming communities. We have seen that they're too technical, too complicated, and often not in Spanish. And with some of the changes that we have been seeing in terms of how information is going to be laid out of some official agencies, we might need to step in and make sure that the information gets out there in a language that they understand. Also, wage and their capacity to get prepared might be diminished. Again, inherent dangers of the health and impacts of their work. They work outside. We're talking about a natural environmental event. Um, they're likely to be displaced and their access to healthcare is limited or depends on financial resources. So um, being a seasonal migrant for worker comes with also the burden of having additional challenges when it comes to your health and being able to manage emergencies. So flooding events, when we talk about how the flooding events impacts the migrant seasonal agriculture workforce, I talk about clinical exposure due to spills. It's really important that we engage with employers and making sure that we have a chemical inventory, that we make sure that the storage is appropriate. So some of the events that we have seen exposures are due to spills when it comes to a direct impact of the hurricane that affect the storage area. Um, I mentioned the heat after disaster, also some of the fall injuries during hazard mitigation events. We have seen this when we work on the areas that need some kind of reinforcement and protection. People are working fast to prepare. So we have seen that there's some increase rate of injuries and falls just because of the process of preparing. And again, I mentioned mental health and well-being because it's a really big part. You're trying to work and protect the work that you're doing, but also trying to prepare and work with your family to make sure that they're safe. Um, Viral and bacterial infections are also a risk because of the polluted water that may be in the area when they're working outside. And then chronic disease management and care that are interrupted. So you may have workers that are used to some kind of medicine or they need some kind of medicine to be able to work normally, and they're not able to access that medicine throughout the recovery and um, basically the immediate aftermath. Just to reinforce the heat piece of it. Sometimes we talk about the hurricanes being able to, um, let's say, cool down the waters. They usually there are these massive systems that take out the heat out of the water and move it around. So we expect um, some of the directly impacted area to have a lower temperature, but the areas who might be around may have um, heat events out of that weather event that happened in another area. So just think about that even if you don't get that directly impacted by the hurricane, you might have an aftermath of heat um, that also usually gets combined with the lack of energy because of power damage that happens because of the hurricane. And we have seen this in Florida. We've seen this recently in Houston, even though it wasn't a hurricane, we saw that there was an issue with the power grid and heat and temperatures were really, really high and people were just not able to cool down. Even if you're not working, if you're at home or if you're at a shelter, you were not able to cool down. So um, let's make sure that when we talk about hurricane preparedness and response and recovery, we talk about heat and how to manage heat and hydration and manage your medicine because temperatures are going to go up, especially if you're in an area that was adjacent to the hurricane but not particularly directly impacted. And again, just to put in perspective, this is important for farm workers because their agriculture workers are 35 more likely to have a death from heat-related illness than the average worker. So if we're talking, this is in normal circumstances, we're talking now in an after event situation. Um, we're seeing that agriculture workers, construction workers are higher, have higher risk of being exposed to heat and die from it. So we want to make sure that we have that heat conversation related to hurricane preparedness, not only because it's summer and not only because the season is related to that. Biological agents, water gets stuck in some of the areas. We're gonna see mosquitoes if you're living in a tropical area. We have seen some patterns of some of the we saw dengue last year reach some of the areas in North Carolina and South Carolina that were not used to see them. So just keep in mind that mosquitoes are something to watch for. Water gets stuck. Is gonna in because of the temperature that we're seeing and the humidity, it's gonna produce mosquitoes. We're gonna see them, and you don't want them being bite by them. Having dengue after a hurricane is not what we want to be addressing in our clinics. Also, mold and mildew out of filtration might be their camps of their home or the area that they're working on. After filtrations or flooding, there's some mold and mildew work that we need to do. Make sure that we do removal. So there's our biological agents that are that workers are exposed to that might affect either their skin or their respiratory tracts. So we're going to see asthma, but we also can see some of skin reactions depending on how sensible they are for mold and mildew. And then leptospirosis is one of the leading cause of infections after a hurricane. We've seen it in water. Some of the water gets polluted by um, animals or rats, and then it gets injected, like it gets like ingested, or you get in touch with it out of a wound or something, and you might get infected. So bacteria also is something that we need to talk about. Um, there's in some cases when we see the water infrastructure compromised, we also may see people that get from water sources that are not safe. Some gastrointestinal issues related to bacteria. So again, talking about polluted water and how to manage water that might not be safe for drinking and how to make it safe for drinking is something that we should be included in our conversation with patients and workers related to hurricane preparedness. Again, I'm trying to go over the stuff that we usually don't talk about. We kind of focus for hurricane preparedness in maintaining our houses safe and maybe having food or storage in our places where we don't talk about a lot of the aftermath when you get out there, what it comes to what are your risks and what we should be watching out for. I mentioned that this has an impact on community health centers. We saw this in a couple of the recent hurricanes. Health centers are going to be the first recipients of people searching for medical help. You want to make sure that the more that you can prepare your communities to withstand this event, at least, let's say, ideally, you want them to be able to manage from themselves in the community around 10 days. So you can focus on one, making sure that your health center is okay, that your infrastructure is complete, and you're able to get your human resources back to the clinic. Second, you want to make sure that you're able to have the capacity to respond to immediate situations that are emergencies, that are not continuity of care situations, but more like something that had a direct impact in a person. So in immediate situations, the more prepared the community is, the less likely are you to have your hands full when something like this happens, and you're able to focus on the more emergent pieces. And also focus on your staff, because likely your staff is part of the community and also affected. So you want to make sure that you have that 24, 48-hour period when you're focusing on your staff and your clinic, and make sure that you are prepared for the months to come. We know that this is a long, when we have a high intensity hurricane hitting our area, this is probably a year. Luckily, if we're good, if we work through it, it's a year of recovery process, and you want to make sure that your staff is good to go and they have the well-being is secure, they're able to work, and that your clinic is operational. So making sure that they're prepared uh, will decrease the impact that it has on the health center. If you're with your hands full, you're likely then to have operational issues, clinical issues, because you're not able to follow up, and you're gonna have issues with your staff. So some of the studies that we're promoting to work with communities and migrant workers, the first piece is, if you haven't done so yet, working with your clinic to make sure that your clinic is sustainable and can withstand these events. Your infrastructure, making sure this is something that we work with the National Association of Community Health Centers, the 4 pillars in terms of sustainability during weather events. Um, Energy and water system that have backups, make sure that you have that. Your relationships with community and partnerships, you need to work on those beforehand. Let's just make sure that we have a strong community engagement piece, that we are integrating our community in our preparedness plan. Make sure that your community know, hey, this is our process right now, for example, and this is a really easy one. Let's communicate our patients. What happens is a hurricane comes, when do they get their meds? What's the process? Are they gonna get a call? Are they supposed to show up? You don't want them showing up 48 hours before the hurricane in line your pharmacy asking for the prescription because they fear that they're not gonna have the refill. So having that communication with patients about, okay, this is what happens. Um, Pharmacy is gonna call, or community health workers are calling and making sure you have your refills. You don't have to come in unless I'll call you. So make sure that you have some control over what happens, because people are gonna get agents. So when we talk about that developing relationship with communities, make sure that you have some really good community leaders and community-based organizations that can flow information to you as well. Are your communities getting prepared? Something's coming. So you want to have that relationship before. So when it comes to it, it's easy and you don't have to struggle getting information. It's just like, okay, so you can do like your WhatsApp group, or you can have a email chain, or you can have some kind of communication system. Um, when you have a track of what's going on in each of the communities, and you have that flow of information, you know where your patients that need some special care are, you know where your shelters are, they know that you're going to show up with to the shelters, that you're going to be fine. They don't need to come running to you for their usual care, because they're going to get it, and there's a process to that. So we have to open that line of communication to avoid having that surge of people just looking for answers that we are able to communicate beforehand. Um, Clinical training and support, especially for your staff, make sure that they know how to work with patients during these events. We have new staff coming in and we have previous experiences, let's have a time to share that, what we have learned from those experiences, make sure that that gets passed on, so they know how to manage, they know what to expect, and make sure that you have appropriate language support. And then again, we talk about mental health and well-being, in this case, specifically to your health center staff. We know that the staff not only is going to be impacted by the event itself, but also they're going to be recipient of all the situations that they tend to once the hurricane passes. That community that they have been working on immunization is now flooded. That community or school-based effort that was going on got impacted, and now that kid that they work with is in a shelter and they saw them. So that all that information, all that trauma that they're processing needs some support as well. So make sure that you have some well-being and mental support to your health center staff to be able to process these events, these hurricane events, especially knowing that farm worker and agricultural worker communities are highly impacted and vulnerable to these situations. And then why are we engaging communities in emergency management? Why would we have to do this? We have seen the recent experience with natural disaster and the appropriate responses to each of those. We have seen or gaps and challenges in them. We know we can sit down and know what needs to be fixed, what needs to be actually kept. We saw really good stuff in some of the hurricanes that we have. We have some organic responses from community. We want to keep those going. We want to make sure that if something happens, that gets put together and sustained. Also, our national emergency management frameworks acknowledge that we need to do a bottom-up approach to make sure that communities are safe during emergencies, which means that preparedness come from communities up and not from the government down, because who knows your community is their own community, who knows your needs. Your clinic might be able to, and if you're really engaged with your community, your clinic, your health center is going to be really ingrained and know the needs. You want to make sure that when you get asked the question, what do you need? Are you able to respond? And this is a kind of like interesting perspective to know. For example, and we can put it like really basic. We saw a community um, in Atillo, Puerto Rico, that wasn't asked what they needed, even though they had the system. And they had a really high population of people who were elderly. However, they received baby diapers as part of the supplies that they were getting because of lack of communication with the government. So this is the kind of stuff you want to avoid. You want to make sure that you have that bottom-up approach. So when it comes to the question, if you're seen at the clinic, you're the health center, you're likely to be tagged in as somebody who knows, and they're gonna ask you, what do they need? You should be able to respond. You should be able to be really specific of what you need. Not I we need all. No, what do you really need? Is it water? Is it diapers? Do we need diabetic medicine? Do you need insulin? Do you need ice? So you want to make sure that that communication comes up, because you're gonna get the question when it's a high intensity, a high level damage hurricane. You're gonna get the question, so you want to make sure that you take the opportunity and get exactly what you need. Otherwise, we're gonna have one, your storage is gonna be full of stuff that you don't need, and two, you're going to lose time struggling to find what you need later on, and you may not get that chance again. Also, there's a piece of compliance and management. We're required to have engagement with communities to do emergency management as part of our mission, health center missions. And as I talked before, there's direct and indirect benefits for the health centers when we do this. Okay. When we do work with communities to do this community mobilization model, this is something that we are highly recommending people to work with health centers and community-based organizations, is to do a community mobilization model to address hurricane preparedness. Make sure that you work identifying challenges and opportunities based on previous experience. And what you're gonna do is you're gonna divide those up in before, during, and after. So it's the normal community mobilization model that is used for um, AIDS or pandemics or immunization deployment. It can be used for emergency management. You just need to frame it in before, during, and after the event, and you should be good to go. You're gonna identify your needs and resources beforehand, because you want to know, one, resources and needs that you can address even if we're not in a hurricane. There's some stuff that's kind of like, that's an easy fix. For example, we had a community that said, like, oh, our shelter is being managed by X person who's now be moved to another place or neighborhood and no longer part of our community, and we want to make sure that that management get passed on for somebody who live in our community. It was kind of like, that's an easy fix. We can go have the conversation with the municipality, make sure that that person gets identified. You have the keys, you have the new process, shelters back to the community hands, we're fixed. So that's not no longer a need, no longer a challenge. You can get past that. There's some resources that you're gonna need that you may not have at the moment, but you can identify it. And then you want to make sure that you build capacity among those community members. Might that be migrant farm workers, or I will really urge you to work and build capacity among employers to make sure that they have what it takes. They have the capacity to work with you to make sure that those migrant and seasonal agriculture workers get what they need to withstand those events and make sure that they are healthy and safe during and after. This is just an example of the community mobilization process that we have used. This is a clinic. They've done a really great job in several of the recent emergencies. Again, and I'm talking about my experience and what I know and seen throughout my work with MCN. This is, I think, 2019. just before COVID. So we were actually responding to earthquakes. So Puerto Rico had 2017 Maria. After that, we got kind of a break, I think. In 2019, we had the Southwest earthquakes, and there were some needed to respond out of the health centers to make sure that communities were right. So they will gather or show up in places where people, you can see there's a food truck going on. So they show up to a place where people were getting food to make sure that they were in touch with their communities. And after that, they actually work with farm workers to make sure that the food that was safe got delivered to the people in need for food. So there was a buy-off of the products, and they used with the help of their staff, they used the deployment of the food to make sure that people had food at their table, which kind of was a win-win because product was there, sitting in place, people were needing food, so we just needed some infrastructure to make sure that the food got moved. Um, we also see some really good outcomes out of working the community mobilization model for hurricane preparedness. It creates a strong relationship among community members. We have seen also there's a self-esteem that goes up when they notice that they're able to respond and create frameworks by themselves. So understanding that they're able to and they don't have to wait for instructions is really not only fun to see, but really a really good product of working community mobilization. There's also build capacity and self-efficacy that goes up. You can see here, this is a community in rural Puerto Rico that when they were creating the emergency preparedness plan, they asked for CPR training. So now you have the little girl on the corner trained on CPR because they actually have bad experiences out of being incommunicated and having people go into cardiac arrest. So they want to know they went able to get that certification on, and they were really. I think it was just only the their understanding of themselves and the capacity that they have right now and how they move after that in the other emergencies really shows up the impact that they had on the capacity building piece of it. And then there's a question always is, wasn't it for me? Why, as a clinician, I'm involved in this process? A clinician is a trusted messenger. So when we talk about disaster preparedness, you're the person providing care to this patient, to this community. They already trust you with their life and their health. So the importance of the clinicians talking about hurricane preparedness and linking that trust to their health goes beyond what we can say. Like we have some really good champions that are medical directors talking to communities about why it's important to have water in storage for hurricane preparedness. We have some good social workers talking about why we need to have a family plan. So it's really about the trusted messengers. Also, there's an understanding about healthcare options that other entities will not have. They will be able to support preventive practices. If you know somebody has a condition in particular, you're able throughout your care to work with them to make sure that they do what they can to prevent. And this is a really basic example. You have somebody who has a kidney disease, you want to be able to talk with them about the type of food that they bought in Greggan season that will not affect their kidney disease. You want to make sure that they are not buying stuff that is high in sodium, but also talking about it as it's part of their care rather than something that is extra. Um, and also, we as clinicians in health centers, we are used to adapt information to the needs of migrant seasonal agricultural workers. So we know we are able to do that. It's just a different perspective. We're talking about hurricane preparedness, and we know what needs to be done. So we're used to adapt that information. We're able to do it. So we have a really big role into preventing the implications in health and safety for those workers if we can throughout our programs. Talking to our patients about proper chemical storage. securing cabinets, chemical inventory, personal protection equipment. This is when we are getting involved with employers. We want to make sure that there's no spills out of the hurricane process. We want to make sure that there's no pesticide um, exposure, but also if there is, we want to make sure that there's personal protection equipment available for farm workers and migrant workers to use when they're working in to repair that spill. Make sure that we work with them in preventing risks at work, especially when we're talking about heat exposure management. And ideally, the employers in farms are part of the community that you get mobilized to work in your emergency care management plans. If we get them together, understand that you need healthy workers, and the way to get healthy workers throughout these emergencies to work with me and created this comprehensive plan on how we're going to prepare and respond to hurricane, you're less likely or you're going to diminish the type of impacts that you have in your crop. You're going to avoid people not showing up to work. We're going to avoid people being hurt at work if you try to work with us. And finally, we have some resources. Again, even though they don't say hurricane preparedness, you can see how we work heat-related illness, so you can adapt this. This work with Farmworker Justice and Migrant Clinicians Network are available in English and Spanish. Again, this is something that is a different perspective. We're seeing heat-related illness when we are after a hurricane, so you want to make sure that you take a look at that. There's also the Respiratory Health comic book, and even though this one is being used for wildfires, you can take a look because it explains respiratory protection that you may need to use for mold and mildew remediation or spills management. So just take a look at those and just use what you need based on the different exposures that we talk about. And to access our resources, you can connect with us either in a webpage or social media and get some updates out of new resources that are about to come out. Thank you.
Thank you very much, Dr. Pagan. Here is Dr. Pagan's contact information. If you have additional questions or you would like to reach out to, inquire on anything related to this presentation. But again, thank you very much for taking, of your time to present and, share that incredible information with us today. So this concludes the recorded part of the webinar. We're going to continue then with the Q&A section.